Hi, I'm Lola Forrester. Welcome to Jab Jabber. Hi Pauline, can you just let our listeners know who you are and who your mob is?
I'm Pauline Deweerd and I'm the Executive Director for Aboriginal Health at St Vincent's Hospital in Sydney, and I'm a Yuin Gadigal girl connected to the New England region and also the far south coast.
You've been on the front line of healthcare for COVID-19 patients in the ICU. What have you seen?
Well, look, I mean, visiting the patients within ICU and having experience of all patients within ICU, but, during the COVID period, what I've seen is very unwell patients. Some of these patients are on ventilators, having breathing machines to help them breathe. There's, they're very critical. But the thing that I see is the loneliness and the isolation from families because they get no visitors.
How is COVID impacting on the Aboriginal community in Sydney, and especially the inner city?
It's now rapid in our Aboriginal communities. We've seen it firsthand or heard firsthand that hit the Western New South Wales, but it's been slowly climbing within the inner city. What we done in the inner city is we grabbed it as quickly as possible and promoted the social distancing and educating our communities around COVID.
Are you worried about our communities if they don't get vaccinated, especially your own community?
Oh, look, we're very worried. We want everyone in our community to get vaccinated. It's about helping to protect themselves and each other from COVID, as well as being able to enjoy the easing of restrictions. And this is, for us as Aboriginal people, and let our mob come back together. And, we have to get vaccinations. And the most important thing for us is about catching up with our families and our friends, which is more important to us around coming back together and able to lean and have the yarns. Vaccines are available across over 3,000 places in New South Wales, including Aboriginal medical services, pharmacies, GPs, and New South Wales health clinics. It's really important, and I am worried that our people are not getting vaccinated, but they're now standing up and going, we want to be vaccinated.
Well, as you know, a lot of our mob have health conditions like diabetes, heart and kidney problems. Is it dangerous for them to be vaccinated?
Oh, look, underlying chronic health conditions such as heart diseases, diabetes, or medical treatments like chemotherapy can affect the immune system, which reduces the body's ability to fight COVID. But the best way for people to protect themselves from this underlying health condition is to get vaccinated so that they can fight against COVID-19. Around 80% are less likely to catch COVID-19 when you're vaccinated. And according to a study by the New England Journal of Medicine, you'll be less likely to pass it on to someone else who can get quite seriously ill. And getting vaccinated is probably the most important thing, and it helps protect those around you as well as yourself.
Can fully vaccinated people still catch COVID?
Look, vaccines are proven to be effective against COVID, including the Delta variant. While no vaccines are 100% effective at preventing illness, vaccinations reduces the chance you will catch the virus by around 80%. If you do get COVID, being fully vaccinated means that you are likely to have a mild or no symptoms and the virus will clear more quickly. 2 doses of vaccine gives you around 90% protection against hospitals, admissions and death, and reduces the spread to others.
Is there a time period between the vaccinations from your first vax and then your second vax before you are probably safer?
We reduce the timelines between vaccination, but the best thing to do is go and have them. Your experts will tell you when you're due for your next one.
Can fully vaccinated people still spread COVID?
Vaccinated people who catch COVID-19 can still pass on the virus to others. So it's important to continue to follow other health advice, like wearing a mask, keeping your distance from everybody, and washing your hands.
Have you met people who have a fear about going to hospital to get a test because of they're hearing about cases in hospital?
Well, the fear of hospitals for us has always been, we didn't like to go to hospitals. It was always a place that we said goodbye to our loved ones, and it was a place that our people thought it was a place of dying. And, COVID will bring you to hospital if you're really, really unwell. But as I said, vaccination have been always part of our life as Aboriginal people from the day we were born. When you go to preschool or you want to put your children in school, if you want to go into the workforce, you've got to be fully immunised. Have we ever questioned those immunisations before? We probably never did. And I'm a mother and I just thought it was normal. And I thought it was something that I needed to do to protect my children from all diseases. And this is another disease that's come to us, and vaccination or immunisation is a priority to prevent us from COVID.
Pauline, thank you very much.
Thank you.
That was Jab Jabber, an interview series produced with support from the New South Wales Government.